Welcome back. Is a single dose of the Johnson & Johnson vaccine enough to protect you from COVID? Dr. Nicholas Testa is back with us, the Chief Medical Officer with Dignity Southern California. First off, thanks for joining us, Dr. Testa.
Thanks for having me.
Okay, so Johnson & Johnson, Pfizer, Moderna, 1 versus 2. Okay, what would you say to people who are worried that one dose of a vaccine just isn't enough?
So the Johnson & Johnson vaccine it's vastly easier for us as a healthcare delivery system to have a vaccine where we can just give one dose. It's easier if we're discharging people from the hospital. It's easier to access difficult communities. It's easier for patients who can't return to get that second dose. So the J&J vaccine has the same outcomes for severe disease, right? So we see the same decrease in death and hospitalization, which is exactly what we want to see. And the truth is that we just need people vaccinated as soon as possible to stop the rampant spread, because it's the spread that's causing all these other variants that is really going to give us problems. So the key thing is that we have vaccines that are different options that we can get out in the community.
And I could be wrong on the efficacy, but it's 85%, right? Isn't that still better than a flu vaccine?
The efficacy for the J&J is really good. And the main thing, remember, we look at is preventing serious complications, hospitalization and death. And the efficacy was equal for all three vaccines.
Okay, so now let's talk about people who've actually had COVID. We're talking about the long haulers. They have a wide range of symptoms after they've recovered from COVID. Some of them are debilitating. What are you learning about COVID now that we've had it for over a year?
So the literature that's out there right now shows that about 50% of people at 90 days have some residual symptoms. Those symptoms are most commonly fatigue, shortness of breath, and difficulty with exercise. These are called long haulers, as you just referred to. And the truth is, we don't know a ton about it just yet because COVID's only been around for about a year. It looks very similar to chronic fatigue syndrome that we've seen with other infections. That's what it's speculated to be. And there's speculation that up to 1 in 10 patients could have this at up to 1 year. But the challenge is we just haven't had COVID around long enough to really know what this is going to look like. So it's still a real thing, but a lot to be learned.
And then as we wrap this up, I mean, the vaccine is wonderful. We're glad we have it. Are we getting better treatment options as well? I know we learned a lot. But are our treatment options, if you do get it and if you go to the hospital, better than even 6 months ago?
Great question, Phil. Yeah, and when I go to our hospitals, what we are doing every day is improving at both protecting our providers who are taking care of patients, as well as using both very advanced therapeutics and then some basic ICU techniques that we've brought to bear. So we're doing a lot better taking care of COVID patients than we were 6 months ago.
Well, Dr. Testa, it is always a pleasure to see you, and it's wonderful to actually get to talk to you about the positivity of a vaccine. And as you mentioned, Johnson & Johnson, Moderna, Pfizer, AstraZeneca, just get it if you can get it, correct?
Correct.
Thank you so much, and we'll hope to see you again very soon.
Thanks, Phil.